click here. I don't know. Always feels weird.
Okay, I'm gonna do my test real quick.
Okay. No. You don't mind.
Testing, testing, 1, 2, 3, testing.
One more time.
Testing, testing. Good. Mic check. Second mic check.
Good afternoon, and thank you for joining today's COVID-19 media briefing. Overall, we remain in a hopeful place, and there continues to be evidence that our tools to fight COVID-19, including the bivalent booster, therapeutics, and testing, are working well. Today, I'll go over our current COVID-19 metrics, and because there continue to be vulnerable groups within the community, I will share information on protections and resources available that I hope everyone takes advantage of. Next slide. As always, I begin with our trend lines, giving an overview of where we are at this point in the pandemic and how it compares to what we've seen in previous years. On this slide, we have cases, hospitalizations, and deaths from the beginning of the pandemic in early March 2020 through today. The green trend line shows the 7-day average of the number of cases reported daily, and it's measured using the vertical axis on the left. The average number of reported cases is 1,050 per day. This remains relatively stable from the 7-day average of 1,000 cases that we reported last week. This trend line gives a fair overview of patterns we are seeing in transmission. However, due to at-home tests, we know that a smaller proportion of cases are reported to public health now than at earlier points during the pandemic. The orange trend line shows the 7-day average number of hospital admissions. This past week, there was an average of 106 admissions per day, showing little change from the 103 admissions per day last week. These numbers are comparable, as you can see, to what we were seeing near the end of our summer 2022 surge. The blue line on this slide shows the 7-day average number of deaths reported daily, and it's measured by the axis on the right. We're currently reporting an average of 18 deaths per day. I extend my deepest sympathies to those who have lost a loved one to COVID-19, and I'm so sorry for your loss. My heart goes out to you, and I wish you comfort and strength. Next slide. Using the CDC's community levels framework, which looks at the case rate and 2 different hospitalization metrics, this week, as you can see, LA County remains in the low community level, with a reported case rate of 72 new cases per 100,000 people. That's just a tiny bit higher than it was 2 weeks ago. The case rate has remained stable, staying between 65 and 75 per 100,000 people since about the middle of January. For the first hospitalization metric, the number of new COVID-19 admissions per 100,000 people, LA County is currently at 7.5. That went up a little bit from 7, which is what we reported 2 weeks ago. For the second hospital metric, the percentage of staffed inpatient beds occupied by COVID-19 patients, LA County is currently at 3.9%, and that's stable compared to about the 4% that we reported on February 2nd. This is our 5th week in low, and I remain hopeful that we're in a new phase of this pandemic. Factors contributing to the stable and relatively low numbers that we're seeing likely include the fact that many people have some built-up immunity, either through vaccination or infection. And we have really great tools to prevent severe symptoms that typically lead to higher hospitalization numbers. I appreciate all the residents of LA County who are using sensible precautions as warranted. This does help keep transmission lower, and it provides protections to those who are more vulnerable. Given the recent studies demonstrating the potential longer-term risks, especially those associated with long COVID, avoiding infection remains prudent. Next slide. Knowing that cases are undercounted, wastewater data helps us understand the level of COVID-19 circulating in LA County. The graph on this slide displays our viral concentrations of SARS-CoV-2 in wastewater from May 29th of 2022 through February 4th of 2023. That blue line is a weighted average for viral concentrations across 4 wastewater treatment plants, and it's weighted by the population that's served by each plant. As you can see from the graph, our SARS-CoV-2 wastewater concentration dropped significantly in mid-January, and it's been hovering right around 30% of the summer peak concentration. This week, the concentration level is at about 36%, placing LA County in medium concern for wastewater concentrations, according to our LA County early alert metrics. But you can see it's moving. There's a little bit of movement here. As a reminder, the most recent wastewater data we have is from samples that were collected during the week that ended February 4th, because it does take time for the samples to be analyzed and then reported to us. But we'll watch this carefully. The wastewater data does reflect what we're seeing in our other metrics. COVID indicators are of lower concern than we expected this winter, and yet there's no indication, as you can see, that we're completely out of the woods with COVID. We anticipate seeing these small fluctuations in transmission in the weeks ahead. Next slide. One of the reasons we urge residents to continue to take common sense measures against COVID is because we observe each week how the virus is still evolving, with new strains circulating and potentially gaining dominance. New strains often bring with them more potential for infection. On this graph, you can see variance as a percentage of all specimens that are sequenced as of January 28th. And again, just as a reminder, we do, with this, as with wastewater, we have a 2 to 3 week lag because this is lab data and it takes time here, in this case, to sequence the specimens. XBB 1.5, that's the orange section at the top of the bar, is the strain on everyone's mind. In mid-November, this strain began to appear in the United States and in many northeastern states, where in less than 2 months, XBB.1.5 was the dominant strain. There are currently regions in the country where it accounts for 95% of sequenced specimens. But in LA County, we are seeing a different pattern. XBB.1.5 arrived later in LA County than it did in the Northeast United States, and we've seen a slower growth trajectory. There's been a steady increase in XBB.1.5 since mid-December, with the exception of the week ending January 28th, where XBB.1.5 accounted for roughly the same percentage of specimens as the week before. And you can see that clearly on this graph. Based on the CDC nowcast estimates, other regions covering western states, including Washington, Oregon, Colorado, and Utah, also have XBB.1.5 proportions remaining level the last 2 weeks in January. However, CDC is estimating that XBB.1.5 proportions in these areas will increase in February, and we may see a similar pattern here in LA County. In LA County, as of January 28th, XBB.1.5 accounted for 34% of sequenced specimens. And that's the same as BQ.1.1. We also recently began to track CH.1.1, that's the light blue bar, and it continues to hover at just under 2.5% of sequenced specimens. Even though we're tracking on this, because CDC is tracking on this, we've really stayed relatively stable with this new strain since November, when we first started finding specimens. The CDC calculates predictions of the estimated proportion of each COVID strain circulating now to account for the fact that we've got this 2 to 3 week lag in the lab data. For Region 9, which includes California, the CDC predicts that XBB.1.5 currently is going to account for about 55% of our cases. Within this data, we're always looking for big shifts, signs that the strain is particularly good at evading immunity or driving potential for infection. As of now, we're not seeing any drastic shifts in the variant proportions that would be a cause for alarm. While new strains always have the potential to drive surges in cases, we have more tools now than we've had at any other point during the pandemic. And to date, we've not seen a major increase in cases or severe illness that can be attributed to XBB.1.5. Next slide. We do, however, continue to see clear signs of transmission within the community, especially in close settings where transmission is more likely, such as schools. On this slide, you can see the number of new outbreaks in TK through grade 12 school settings and youth programs from October 2nd of 2022 through February 11th of 2023. There are breaks in the data for the weeks overlapping Thanksgiving and winter break when schools were not in session. Last week, there was a total of 18 new outbreaks in our schools. This is the same number of outbreaks we saw the week before. We continue to see the largest number of outbreaks in elementary schools. That's the light purple on the bar. To help reduce COVID-19 in schools, students and staff should really be staying home if they have symptoms of illness, including sneezing, coughing, sore throats, a fever, body aches, or they're unusually tired. To prevent outbreaks, testing is also essential after COVID exposure, or if a person has recently participated in high-risk activities, such as travel. And all students and staff are encouraged to get the updated bivalent booster if they've not already done so. Next slide. Although our hospitalization and death rates are much lower than they were the past 2 winters, we know there is an opportunity for improvement, particularly because we continue to see evidence that the bivalent boosters are an important and effective tool. On this table, you can see the hospitalization rates per 100,000 people for the 90-day period that ended January 31st, and this is stratified by age groups. The first row shows hospitalization rates for people who are vaccinated with the updated bivalent booster. The second row shows rates for people who are vaccinated, but they've not received the updated booster. And the third row shows rates for people who are unvaccinated. I'm going to start with the far column that shows hospitalization rates for people ages 80 and older, because these hospitalization rates, as you can see immediately, are the highest. Within this oldest age group, people who are unvaccinated are more than twice as likely to be hospitalized when compared to those vaccinated without the updated booster. And they're more than 3 times as likely to be hospitalized when compared to people who are vaccinated with the updated booster. This is the most vulnerable group, likely because they tend to have more underlying conditions due to their advanced age. Looking at people's ages 65 to 79, the protective factor of the bivalent booster is even more pronounced. The hospitalization rate for unvaccinated people 65 to 79 is over about 1,100 per 100,000 people. That's compared to 95 per 100,000 people for those who have received the bivalent booster, making those unvaccinated more than 12 times more likely to be hospitalized. While the hospitalization rate is lower for those ages 65 to 79 who are vaccinated without the bivalent booster, this group still has nearly 3 times higher a hospitalization rate than for those who have received the bivalent booster. We see a repeat of this pattern across all age groups, where hospitalization rates are significantly less for those who have received the bivalent booster. And at a time when we're seeing newly emerging Omicron strains, I strongly believe that the updated booster has a significant role to play in reducing the hospitalization rates. Next slide. On this slide, we're looking at death rates for the same groups for the 90-day period that ended January 24th. Compared to those 80 years of age and older and vaccinated with the bivalent booster, unvaccinated people in this same age group are almost 6 times more likely to die. There's clear evidence that the bivalent booster adds protection, even compared to those already vaccinated without the bivalent booster, with the death rate in the unboosted group 2.5 times higher than the death rate in the boosted group. People 65 to 79 who are unvaccinated are more than 15 times more likely to die compared to those who have had the bivalent booster. Even those who are vaccinated yet have not received the bivalent booster are nearly 3 times more likely to die compared to those with the bivalent booster. The data clearly shows that the bivalent booster provides substantial protection against hospitalization and death across all age groups. And this is especially important for older residents who face the greatest risk. While the continued affirmation that our vaccines and the new bivalent booster work well is great news, it's also distressing to know that resources that help prevent death are available and that they're not being taken full advantage of. Only 40% of eligible LA County residents 65 and older have received the bivalent booster. Knowing the increased protection that it provides, I hope we can get this number higher by making it easy for older residents to access good information about this protection and the boosters themselves. Next slide. Getting to a vaccination site, especially for people who are older or have disabilities, may present a difficulty. We have worked to make resources available so that everyone who wants a bivalent booster can get one, free of charge, regardless of immigration or insurance status. Free transportation is available to and from vaccination sites for people who are unable to drive or otherwise can't get there on their own. This includes paratransit options, which can accommodate wheelchairs or other mobility limitations. To ask about options and make an appointment for a pickup, you can phone the Public Health Call Center, 1-833-540-0473. We're open between 8 in the morning and 8:30 at night, 7 days a week. LA County also continues to ensure homebound access for anyone who has trouble leaving their residence. Currently, COVID vaccines, including the bivalent booster and flu vaccines, are available for anyone who's homebound. Residents can schedule an appointment by themselves or for a loved one. Within LA County, we also have drive-through vaccine options. These allow people to stay in their vehicle, whether due to mobility issues, anxiety about going into places with crowds, or any other reason. The Public Health Call Center can help you locate a drive-through site that fits your needs. Telehealth services to make it easy to get therapeutics. These are the medicines you can take if you're infected. Also continue to be available in LA County for all residents. And this may be especially helpful to those who are older, have a disability, or an underlying health condition. Without leaving your home, if you've tested positive for COVID-19 or suspect you may be positive, you can talk with a provider at no charge and receive free therapeutics if you're eligible. The therapeutics will reduce the chance of severe illness, and they're going to be shipped to your home, and you'll get them within 24 hours at no charge. All of these services can be accessed through the Public Health Call Line. Again, that number, 1-833-540-0473, available 7 days a week. Next slide. As we can all see from the data shared a few minutes ago, older people continue to be at much higher risk for poor outcomes should they get infected. The rate of hospitalization is 22 times higher for those who are 80 and older who are vaccinated when compared to those 30 to 49 who are vaccinated. And the rate of death is similarly much higher for vaccinated older people than for vaccinated younger individuals. And while those who are younger can take comfort in their lower risk, we can all help protect those at higher risk from getting infected. COVID tests are a critical tool to make sure you're not unwillingly exposing someone who's more vulnerable because it allows you to know your status. While over-the-counter home tests are available for purchase in many places, there are also options to receive tests for no charge. So you can always have them on hand in case you have symptoms, you've had an exposure to COVID-19, or you're attending an event or gathering with people who are older, disabled, or immunocompromised. Tests continue to be available for mail order from the federal government, and each household can receive 4 free tests through this program. Health insurance plans are still also required to provide reimbursement for up to 8 tests per month per member. In many pharmacies, all you need to do is show your insurance information, and then you don't have to pay for any costs up front. Both of these programs are supported by the federal government, and they're going to be available through at least May 11th. That's the day that the U.S. emergency declarations expire. We've heard that the U.S. government may continue to provide free tests by mail until those supplies run out. And we also know that the federal administration is encouraging private insurers to continue to include home COVID test coverage in their policies going forward. Here in LA County, free COVID test kits remain available at many libraries throughout the county, with no scheduled end date at this time for the program. We're providing free test kits to schools in LA County, and over 4.8 million test kits have been distributed for use by staff and children. This program is currently slated to continue at least through July of 2023. Tests are also available at all public health vaccine sites and clinics, and here again, we have no scheduled end date. If residents are connected to a form of community support, such as the shelters, long-term care facilities, early childhood education sites, or community-based organizations, many of these places have been given test kits by public health to distribute for free to their customers, workers, and patients. Since December of 2021, LA County has distributed almost 30 million home test kits across the county. Next slide. We know that there are a lot of people who have tests at home that they're keeping on hand, and they may be hesitant to use tests that are past the expiration date printed on the box. Oftentimes, these tests remain effective and you can still use them. Many manufacturers have continued to test the stability and shelf life of their test kits, and they have data that shows that the test can be used with the same expected accuracy way past the initial stated shelf life. This data was recently presented to the FDA, and an emergency use authorization was issued, noting that in some cases, based on manufacturers, home tests remain effective for up to 12 months after the original expiration date. This is complicated, but there is a very easy way to tell if the test you're using is still effective. And that is, you have to ensure that there's a control line. COVID test results appear as one or two lines. Commonly, the top line is marked as C, that stands for control, and the second line appears next to a T, and that stands for test if you're positive. The control line is what tells you that the test is working. If you take a test and there's no control line, or if the control line is a different color than the test line, or if no lines show up at all within the instructed time frame, the test is expired and you need to retest with a new kit. These home tests are an excellent tool, and they're somewhere between 70 and 80% accurate in detecting COVID. False negatives often occur if it's very soon after you've had an exposure and not enough virus is present to detect it. In this case, it's always a good idea if you have symptoms to act as if you do have COVID until you retest. And in taking into account that you may have COVID, you should isolate and prevent yourself from exposing others. To reduce the risk of transmission, please continue to always mask within 10 days after your last exposure to a known COVID case. In closing, I know that for many, COVID is no longer top of mind, and this is actually a good thing. I also appreciate that for others, especially those who are more vulnerable or are living with long COVID, there remains a need for accurate information, access to life-saving resources, and community support for their special needs. At Public Health, we're going to continue to do our best to provide residents and workers with the most up-to-date information we have, and to use that information to guide our county's response to COVID-19. With the lifting of emergency declarations, we remain focused on ensuring easy access to vaccines, testing, and therapeutics. These are the tools that currently make it safer for us to engage in the activities we love. As I look forward, relieved that COVID causes less devastation, I see a couple of things as essential in allowing us to reduce the harms that are caused by this virus. First, the easiest way to reduce the risk of getting seriously ill from COVID is to be up to date on our vaccine coverage. This means that the millions of people in LA County who have not been vaccinated since August of last year, especially for residents over 65, they should go ahead and get the bivalent booster. And second, if you think you could have COVID-19, please take steps to limit exposure for others. I have faith that we can do this together, and I now welcome your questions.
Doctora Ferrer, sabemos que esta orden federal de emergencia por COVID-19 termina en mayo. Usted hablaba sobre qué va a ocurrir con los residentes que no tienen seguro médico en el condado de Los Ángeles. ¿Van a seguir teniendo acceso a tratamientos, a pruebas? Si nos puede contar.
Aquí tenemos planes que todo va a continuar, que no vamos a parar de tener ese acceso para la gente que no tienen seguro o la gente que no tienen dinero para un copay. Pero tenemos mucho trabajo que hacer para asegurarnos que sí tenemos las vacunas, sí tenemos los test kits, las pruebas y que sí tenemos la medicina. Pero eso es el trabajo que estamos haciendo ahora para que todo el mundo sabe que aquí en el condado, si no tienes seguro, todavía vas a tener acceso a la medicina que necesitas y a las vacunas.
¿Qué va a ocurrir con las pruebas de las escuelas públicas que se les da a los estudiantes?
Eso tenemos que trabajar con el Estado, porque tenemos unos partnerships con el Estado para asegurar que la gente en las escuelas tienen esas pruebas, pero como que ya hay mucha gente que no están sacando las pruebas, tenemos que ver si el Estado va a seguir mandando las pruebas a nosotros.
Finalmente, mencionaba sobre las personas de 65 años o más que siguen siendo las de más alto riesgo. ¿Qué le recomienda a esas personas que no se han puesto la vacuna bivalente?
Es bien importante que se ponen las vacunas. Ahora estamos hablando del booster, el booster nuevo que tenemos. Toda la data que yo aquí estoy dando la información a toda la gente, toda la data nos ayuda a entender que sí, estas vacunas son bien importantes, particularmente para la gente de más edad. Muchas gracias.
This is from Jackie Freer at Jackie Fortier, sorry, at KPCC. The state health department told her that the mask requirement in some health settings is not tied to the COVID emergency, but they refused to say when the rule could end. If it does get rolled back by the state, could LA County Health Department keep the mask requirement in high-risk settings? And would you still have the power to do that after the state COVID emergency ends on February 28th? And are you considering it?
Yeah, thanks, Jackie. So the authority under which masking requirements are in place at healthcare facilities is under a state health officer order that is not tied to an emergency declaration. It's actually tied to the authority that health officers have around preventing the spread of communicable and infectious diseases. That's how it was written. So it does not disappear when emergency declarations disappear. And as Jackie noted, if the state continues that order, then everybody in the entire state and healthcare facilities will need to continue wearing masks. If there are changes in that order, we're likely, as is I think most of the state, going to go along with that. But I want to note that the local health officer orders, including Dr. Davis here in LA County, do have the same authority under sort of under their regular practice guidelines to go ahead and issue masking requirements to prevent the spread of a communicable disease without needing to have an emergency declaration. So it's a strategy you use to prevent spread of diseases, and health officers have that authority.
This wasn't going to be my first question, but given what you just said and what Jackie's question is, I am curious because I know the state of New York lifted its mandate for healthcare workers and patients within hospitals and also at nursing homes, leaving it up to them to decide. So is that the same answer then you would give about when that would happen here in LA County? When do you foresee that being lifted here?
As I said, I mean, the reason we're all wearing masks in healthcare facilities is because we're under a state health officer order. So if the state health officer order is lifted, we're very likely to align with that. I'm just noting that if for some reason, and really I'm noting this because if there was an outbreak, for example, at a healthcare facility, our health officer could go ahead and issue an order in that healthcare facility mandating that everybody wear a mask, and they would do that under their authority to prevent the spread of communicable diseases. That has nothing to do with needing an emergency declaration.
Okay, so we had on the chairwoman of LA County Board of Supervisors, Janice Hahn. We asked her about when will the declaration be ended here in the county. If all goes according to what she said her plan is, it would be lifted here in the county in about a month at the end of March. When that does happen, does that mean that the 10-day close contact mask mandate is lifted?
You know, it's a great question. We're supportive of lifting emergency declarations, and obviously also recognize that the health officer retains that authority to put in place or keep in place measures that prevent the spread of communicable diseases. We haven't actually looked at the requirement for people to go ahead and mask up in that 10-day exposure period. Remember, that's not just for schools, it's for all of us. We're all required to do that. But I would imagine as we're reviewing all of the, all of the community protections that are in place right now, and we'll have a decision obviously way before there's an expiration of the emergency declaration. Again, I don't know that it's tied to the emergency declarations.
Okay, so there's not a definitive answer.
There's not a definitive answer, and obviously working closely with all of our partners to stay as aligned as possible across the county.
Okay, and then while we had Chair Han with us, the question was asked of her, question about you, and does she still have the confidence in you to lead the health department? Here's a portion of her quoted answer. She says, I think we've had a really rough 3 years. I think all of us were thrust into a spotlight that none of us really know how to navigate. She's still our director of public health, but I do feel like over the years it's been tough, and I think she did lose some trust from our public. Your response?
Yeah, thanks for the question. I'm not going to really comment directly on sort of interactions with my bosses. Supervisor Han is my boss, one of them. I do want to say I'm proud that the Department of Public Health has served residents in every district during this unprecedented pandemic, and we're going to continue to do that. When I'm out and about and I'm talking to people in the community, I do hear gratitude and recognition for what we've done as a county over the last 3 years. I also take note of all the feedback people give me, whether it's complimentary or not. And I bring it back to the team to make sure that we're doing the best for the residents of LA County. And I think that probably, is a sufficient response.
All right, our next question is from Luke Money at the LA Times. He says, according to the latest figures from CDPH, California is on the cusp of surpassing 100,000 cumulative COVID-19 deaths. Can you reflect on that toll? And did we ever think that when this pandemic started, we would reach this figure? Also, what trends are you seeing in terms of deaths in LA County, and who is most at risk of death at this point? I think you did address that last part, though.
Thanks so much, Luke. I mean, obviously, the heartache of having so many people die weighs heavily on all of us here at Public Health. I think it weighs equally heavily on everybody who lives in our county, in our state, in our country, in the world. Nobody, I think, anticipated this toll. None of us wanted this to lead to so many people losing their lives. And it creates great sadness. It's hard for our community to recover. I think we're over 35,000 deaths here in LA County alone. The magnitude of that is unimaginable, except for the people who have to live with it. And for them, we continue to keep you in our prayers, in our thoughts. And again, as long as this remains a deadly disease, here at the Public Health Department, we're going to continue to work hard to offer strategies for trying to reduce the burden of death. I did talk earlier, Luke, the population that is hardest hit are people who are older. Many of those people who are older also have serious underlying conditions. And for the, almost a quarter of people who are younger and are dying, they often have significant underlying health conditions as well. So we know from our information, from the data we've been collecting, who's at higher risk. Our job is to make sure that collectively we recognize that there are some people at much higher risk, and we do our very best together to try to enhance their protections.
Another one from Luke. He says some officials have talked about generally pivoting to a once per year vaccination schedule for COVID. How much like the annual flu shot, are there any groups that should consider getting vaccinated more often than that?
Yeah, I mean, it is a great question, Luke. We obviously won't answer it definitively here at the Public Health Department. FDA and CDC will make the decision on what's the schedule and for which populations. But I know as people have been talking, both at the federal level, the state and the local level, about that sequencing of vaccinations in the future, everyone has embraced the idea that perhaps for many people you could go to a once yearly vaccine, knowing that with the vaccines we have now, there is a waning of protection over a few months, which may mean for those who are at much higher risk, the suggestion is going to be that they get more than one vaccine a year. But let's wait for FDA and CDC to look at all of the studies and the data and then send out the guidance for that schedule for vaccinations.
Doctora Ferrer, un seguimiento sobre el uso obligatorio de mascarillas en los centros médicos. Si llega a retirarse en el estado de California, ¿cuál es su plan aquí en el condado de Los Ángeles?
Yo creo que aquí en Los Ángeles hacemos lo mismo, pero siempre vamos a pedir a la gente que se quedan con las mascarillas cuando están en un lugar donde hay más risqueo. Y esos son los lugares, las clínicas. De veramente yo me voy a quedarme con la mascarilla cuando yo entro a una clínica, porque tengo más protección. Yo soy una persona de alta edad y para mí será importante quedarme con la máxima protección. Esta protección también es sobre otras enfermedades que están presentes en los lugares donde están los médicos. El flu, el RSV, todo eso se puede contractar en esos lugares, y si tienes una mascarilla tienes más protección.
I have a question from Marissa Evans at the LA Times. She says a new CDC MMR came out this week, noting that children ages 6 months to 4 years old, or particularly Black and Latino children, are getting left behind when it comes to getting the COVID vaccine. What is your message for families who haven't vaccinated their youngest kids in their household for COVID, and has that changed the department's outreach efforts?
Yeah, it's such a great question. So I could start with some data, which will be sobering data. Only about 12% of children under the age of 5 are vaccinated. And there's big differences between Black and Latino children and Asian and white children. So the rates are, somewhere around 6 or 7% of Black and Latino children, and somewhere around 20% for white and Asian children. So we have a lot of work to do. I want to note that the primary place where parents of very young children go to get information is from their pediatrician or their medical provider. So most of our effort, but not all of it, has been working with pediatricians and providers. We have a program called Vaccines for Children, and we have about 600 pediatricians or pediatric providers in that program who are registered with the COVID vaccine program, and they can go ahead and actually vaccinate the patients in their clinics. And we're grateful that they're fully participating and helping to get their patients, their very young patients, vaccinated. We have another 250 pediatric providers that are not enrolled, but that we've done visits to and provided them with kits and support on both enrolling, but also about giving information to their patients so that their patients have a place to go ahead and get those vaccines. I think the most important thing we've asked pediatric providers to do is to talk with the families about the importance of vaccinating their children, to talk about the safety of the vaccines for very young children, and to talk about and to answer any questions that families may have. We know with a new vaccine, we were anticipating there'd be a lot of questions among families with very young children. We think that's appropriate to ask a lot of questions, but we are urging families to talk with healthcare providers, get up-to-date and accurate information. It's now been, I want to say, over 6 months that these vaccines have been available. I know some families were just waiting to make sure that there were no unanticipated or unknown side effects. We've got a lot more data now. Millions of young children have been vaccinated. So I urge people to have that conversation with their healthcare provider. We also have our promotoras, our healthcare workers out in the community. Many of our community-based organizations also are out there, again, providing accurate information and trying to answer questions so that families will have more confidence in getting and using these vaccines that are easily available and free, and getting their young children vaccinated.
It's just about, I know that we went back and forth on email about the state health department updating its guidance for universal testing at hospitals so that it's not required that you test every single admission anymore. I'd just like to get your on-camera reaction to that.
Yeah, this is the time for us to look at what strategies we still need to keep in place, what strategies make sense, We got more tools, and I respect the state's decisions in regards to how we should be providing care at our healthcare facilities. Most of the hospitals we're talking to are continuing to offer testing to their patients, and from my perspective, that's probably one of the most important transitions we need to make. When we're not requiring everyone to do the same exact thing, we need to make sure we're still offering it, because for some people, it's extra reassurance that they need in order to feel fully comfortable being in a facility. So, thank you.
All right, that's all.
Thanks a million. Have a great day, everyone.